Like with the lungs, where the right pulmonary artery is shorter than the left, the right renal vein is shorter than the left because it is closest to the inferior vena cava. The left renal vein receives vessels not received directly by the right renal vein. For example, the left renal vein cephalica receives the major venous drainage of the left adrenal gland, and caudally it receives the left gonadal vein. The renal veins are ventral to the arteries. When we look at a cast corrosion preparation of a kidney after injecting a red plastic in the renal arteries and a blue plastic in the renal veins, we note that the surface of the kidney has a regular distribution of the red with the blue. Note the uniformity of red and blue throughout the kidney. It almost indicates that morphologically the number and caliber of the veins equals that of the arteries. We are going to see later the differences between the arteries and the veins in different segments of the kidney. Note that the renal vein is ventral to the artery and that the artery is ventral to the renal pelvis. When looking at the renal veins, we note that the right one has a length of 1 to 3 centimeters, the left 3 to 11. The anastomosis with the right gonadal vein is 6% of patient, while there are regular anastomosis of the left renal vein with the adrenal veins, the gonadal, and the lumbar veins. In 15%, we may see more than one renal vein. There is a particular anatomic variation called the circumaortic venous ring seen on the left side, where there is a vein coming from the left side behind the aorta and another vein ventral to the aorta. This circumaortic venous ring, which is seen in 1.5 to 16% of patients, is significant, particularly when aneurysmectomies are to be carried out. Inadvertent severing of the dorsal left renal vein may lead to massive hemorrhage. Isolated retroaortic renal vein has been described in 1.8% of individuals. Another interesting anatomic variation is the presence of renal venous valves. In the major branches on the right side is seen between 28 and 70%, on the left side between 4 and 36%. Also, it is seen in smaller branches on the right side in 16 to 18%, and on the left side in 15 to 23% of individuals.